Hi, a very good afternoon to all here. Welcome to IMU Live Talk. This evening, we have Dr. Shekhar Bhatia with us. I am Liang Lin. I'm currently the Associate Dean of the School of Dentistry at International Medical University. Dr. Shekhar Bhatia is a senior lecturer and endodontist and also program director of the Postgraduate Diploma in Endodontics at International Medical University. So before we proceed to this talk by Dr. Shekhar, I would like to remind everyone a few housekeeping rules. We have muted all the microphones of the participants. For questions and feedback, please use the chat box. You can type all your questions in the chat box and we will try our level best to answer all of them. And also, this live talk will be recorded. So feel free to post questions after Dr. Shekhar's talk, and I look forward for a lively discussion with all of you. So Dr. Shekhar, the floor is yours.
Okay, thank you, Prof. Good evening, everyone. Thank you for coming. Thank you for joining us in this live talk series from School of Dentistry. I'll be talking about our postgraduate diploma in endodontics in School of Dentistry, International Medical University. So just briefly about myself, how did I started, how did I came to this journey of endodontics and how I started. I actually graduated from Manipal University in year 2006. And then I started my post-graduation in RGS, this is Rajiv Gandhi University of Health Sciences in Bangalore from 2007 to 2010. Then I got my membership in MFDS RCPS and MFDS RCS from Glasgow and Edinburgh. I've worked in India for almost close to 2 years in Tirthankar Mahavir University in India. I was very fortunate to be selected in Indian Army. Then I came to Malaysia and I joined as a lecturer in one of the private universities called Masa University. I worked in that university for 2 years. Then I joined IMU in 2014 and then I'm still in IMU. I'm a program director for postgraduate diploma in endodontics, and there I'm still learning, and I'm in front of you. Now, PG diploma in endodontics. I want to tell you more about this program. This program actually is a blend of both, the knowledge part as well as your, hands-on training part. So this program covers, basically it will be having a lot of face-to-face lectures. You'll be having online lectures. We'll be having a lot of seminars, CBLs, a lot of discussion, tutorials. And in a skill development, we have a hands-on training in our simulation lab, which is in IMU. And then you can do your clinical, you'll have a clinical experience through your patient care in our Oral Health Centre, which is located in our IMU, International Medical University, Bukit Jalil. So it's a blend of both your, the knowledge part as well as your skill part. This PG program is actually designed for both as a full-time and a part-time students and those practitioners who wants to continue working in their clinic. So it's basically meant for those people. So it's like a flexible. You don't need to stay with us like throughout the year. It's like you can continue your practice, and for the module basis, you can come to IMU and learn with us. It has 6 modules, which goes up to like 2 semesters. So each semester has 3 modules, 17 weeks each. Each semester has a 17 weeks with a total of 30 credit hours over a period of 1 year. So 1 credit hours actually is close to 40 hours. So we have a total of 30 credit hours. So duration of each module is approximately 6 weeks. Mean to say we have a 1 week of compulsory on-site activities in IMU School of Dentistry. So in that 6 weeks, the first week you have to be with us. You have to come to IMU from Monday to Friday. And so you'll be going through the whole process of, discussion, seminars, your simulation, clinics, and the rest of the 5 weeks you can do your patients in IMU, or you have a choice of doing your patients or your cases in your own practice, provided you follow all the protocols and discuss each and every case with your supervisor. So in postgraduate diploma in endodontics, we have 6 modules. First module is your fundamental science in endodontics. Endodontic management of single rooted teeth. That's the second module. Third module is endodontic management of multiple rooted teeth of moderate difficulty. Rotary endodontics. Management of endodontic cases requiring a multidisciplinary approach. Then management of your failed endodontic cases, like your retreatment in a single rooted teeth and endodontic mishaps. So each, as I told you, it's all 6 modules. Each module will last for 6 weeks. Okay, you'll be having a lot of you'll be using a lot of instruments and different kinds of instruments. So you'll be going through the whole process with us. The teaching faculty in our program is Dr. Abhishek, myself. We have Prof. Xiao, who will be, she's a prosthodontist. She'll be talking a lot about your post-endodontic restorations. Dr. Jack Lam, if you know him, he's a private practitioner. He's a specialist in endodontics in Malaysia. We have Dr. Venkatesh Babu. We have Dr. Sultan Omar Sharif, Dr. Swarna, who's an oral radiologist with us. So you'll be having a lot of hands-on sessions with CBCT. So she'll be helping with us that. Dr. Preena, so she's another endodontist. So we have a lot of faculty who are very experienced. They all have an experience of more than 11 years, 12 years. Some even have 20 years of experience. So very experienced faculty. These are the facilities in IMU. You have an IMU Bukit Jalil. We have our oral health center where you can do your patients. In our oral health center, you can utilize the facilities. These are our clinics. You can use all the instruments, all the materials in IMU Oral Health Center. You'll be provided a dental operating microscope. We have it in our IMU clinics, and we'll be getting our microscope even in simulation. The CBCT machine, we know CBCT is very important in endodontics, so we have that. You can utilize this facility in IMU. And I want to emphasize that this is the only diploma program in Malaysia who is recognized by MQA. So it's a recognized by MQA. You can use this tag of PGD Endo after you finish, after you have gone through the whole, the program, and you have cleared your, the final exam. Once you cleared, you can use this as in front of your name. So this is not like your normal workshop or something like that. You have to go through the assessment part, correct? So this is a rough idea. You can see that slide. So you'll be having a theory exam, which consists of OBAs and SAQ. I think you know OBAs, your one best answer and your short answer question. And then you'll be having an OSCE. So you even have to do your cases and you have to report your cases, so which carries your marks. So you have to go through that assessment. And so this is not like unlike your other workshops, like 3-day, 4-day, it's not like that. You have to go through that assessment, clear that examination, complete your cases, fill your logbook, and then you can get this diploma. Yeah. Okay. Thank you.
Okay, thank you very much, Dr. Shekhar. It's a short and sweet talk to give an overview of the program for everyone to have a brief idea first. Okay, so here now the floor is open for discussion. So please feel free to drop your question in the chat box. We will answer the questions and then we can have a chat with you all. So do feel free. Any questions that you have doubt with regards to the program, we will be most happy and ready to answer them for you. Yep. So maybe I should start this session first, yeah, Shekhar?
Yes, Prof.
So as you have mentioned, this program is specifically designed for the private practitioners or general dental practitioners. So can you just mention a little bit more on how this flexibility can help them. You know, of course, they would like to still be able to continue with the practice, right?
Okay, so yes, Prof. Actually, this is specially meant for those general practitioners who are actually busy with their practice, but they cannot have time to come like every day in uni and do some diploma program. So basically, as I told you, it's like a module basis. So
Mm-hmm.
every module is like 6 weeks. So in
Okay.
that 6 week, that first week, which is like first week of the every module, which is like Monday to Friday, uh, you have to be with us only that time. The rest of the
Okay.
time, yeah, the rest of the time, the rest of that 5 weeks, we are allotting you the timetable, but you can even do your cases in your own practice. Mean to say, you don't need to come to uni. You can do your patients in your own practice, and you can charge them actually. So and IMU don't have any any hindrance in that, or any you can do your patients, you can document your cases, you follow the protocol, like, and you discuss each and every case with your supervisor. So every case you can discuss with your supervisor. Our supervisors, all your clinical supervisors will be very happy, and it's like, you discuss each and everything, every protocol, and you can follow in your own practice. So
Okay.
yeah,
That's wonderful.
yeah.
So okay, so that means if I am a private practitioner, I have my own clinic, and I would like to enhance my knowledge and skills in endodontics. So I can come on this course, but at the same time, I can still maintain my own practice.
Yes, yes,
Yes,
definitely.
that's
This
really wonderful. That's
this is the
really
main
wonderful.
this is the main idea when we were designing this course.
Okay, that's great. That's really reassuring to know that I can still run my practice in that sense.
and and
Okay,
and
so
I can just say something again, and there might be few people who wants to come to IMU and utilize all the facilities and do it, and you're most welcome. Yes, you can do it. We'll provide you the space, we'll provide you everything, so you can come even to IMU and do it here. So it's up to you.
okay, that's good. Okay, there's a question here. Uh, how can the PG students find cases, like find patients, like you have mentioned, to get the diploma
Yeah.
in order to sit for the exam? Then you need to finish 25 cases, right?
Yes, yes.
So how would the students get patients?
Okay, fine. So see, I'll tell you very honestly. Say, obviously, IMU is going to help you. We are going to help you. We have our IMU Oral Health Centre, and we get a lot of patients there in a normal daily basis. And we have something called a restorative clinic, where we screen patients for you.
Mm-hmm.
Obviously, anywhere you go, we cannot 100% promise you that we are going to provide you 25 cases. But yes, from our side, the preference will be given to you. So what we say to everyone is, if you have your friends clinics, maybe in KL, you have contacts with them, or you are working as a locum or something, you can get your cases from there. You can get even cases from IMU. So initially, definitely we're going to help you. IMU is going to help you, but as I told you, we cannot guarantee you that all the 25 cases will be provided by IMU.
Okay, so let's say if I have patients, and can I bring my patients to IMU to be
Yes,
treated then?
yes, you can bring your patients. You can bring your patients, and you can do it in IMU.
Okay,
And,
so
and
then I will be able to get the specialist in IMU to supervise me in that
yes,
sense?
you will be provided a such a specialist who will be your clinical supervisor, who is going to guide you, and you can discuss everything with your supervisor.
Okay, so how do I go about bringing my own patients to IMU to be treated there?
You can get your patient. You can, because we have a very flexible thing. We have a reception. You just take an appointment. It will be screened. So once everything is okay, you need an X-rays. It can be done like your normal clinic. You just need to screen the patient, discuss the case with your supervisor, and if it follows all the criteria, yes, go ahead.
Okay, so like, how frequent can I bring my patients in? You
Okay,
know,
so
is that a specific dedicated
yeah,
clinical sessions
okay.
for me to bring in my patients?
So we'll provide you all the timetable. We'll provide you, like, in hand, the proper timetable where your days will be fixed. and the rooms will be given to you, and there might be slight flexibility. There's sometimes we can understand that your patient can come only on that particular time. It can be sorted out.
Okay, that's really good. So you have mentioned that also we have all sorts of facilities right now in IMU. So what sort of facilities we can gain access to?
Okay, so in endodontics, whatever you need, you need a microscope, yes, will be provided. You need your instruments. So as you do a normal case, as any case comes to IMU, so you'll be given a DSA, assistant to help you. You'll be given all the instruments, all your rotary machines, actually everything. You have a CBCT machine. If your case demands CBCT, you can take a CBCT. Provided, yeah, yes.
Okay, so CBCT, we can take a sectional CBCT, right?
Sectional CBCT, yes.
In IMU, we have actually we have 2 CBCT machines now in IMU. So we have the latest version of the plan maker, so we can take sectional, which is really useful for endo treatment.
Yes.
So, and also maybe I can add on, besides the endo related equipment, we also have library facilities as well. We have textbooks and journals. We even have a huge e-journals database where all the students can access to the database. Yeah.
Yes.
Okay. So the next questions. Can you explain a little bit on the fee structure like for this program?
Okay. So this is the fees which has been decided is like 55,000, but the first batch, the inaugural batch, will be given a 10% discount. So your fees will be actually 50,000, which you don't need to give like together, which is like in 4 installments. And if any alumni joins, they'll be getting like almost like 25% discount for this. So
yeah, IMU alumni, right?
IMU alumni will be getting 25% discount.
Okay.
And the first batch,
IMU alumni out there,
yeah,
listen, you get 25% discount.
Yes.
Yeah, so please take this opportunity to come and learn more. Yeah.
And regarding Prof journals, you said, I can just share with you that in endo, the most common journals what you have is JU and IJ. I think I never had any issues in finding any article in IMU. So it's a great library.
Correct.
You can find any journal from any year actually.
Yeah.
It's available.
And yeah, I totally agree. Even if it's not in our database, the librarian are very helpful to actually source it from elsewhere to get the either e-copy or even sometimes printed hard copy for us as well. So that is definitely agree with you in that sense.
Yes.
Okay, so okay, Dr. Sean Paul, nice to see you here.
Hi, Sean.
Okay. Yes, hi, Sean. Okay, Dr. Sean Paul has asked, so technically we need to go to IMU at least 5 days for the 6th module.
Okay, I'll tell you.
30 days, yeah.
Yes, so every module, yes, that compulsory you have to be with us for that first week, which is face-to-face. Face-to-face means you'll be having all your seminars, your CBL, your lectures, and your simulation. And obviously few clinical sessions. And the rest of the time, it's optional for you. You come to IMU or you do it in your practice. So every module, yes, that first week of every module, you have to be with us.
Yeah. So yes, Sean, that's right. So in that 1 year of diploma, when you undertake this program, then you, all in all, is 30 days that you need to be in IMU.
And even I can mention this, like there might be few people who find, they're doing something else, they're doing implants, or they have a very busy practice and they feel they cannot complete their quota of 25 cases in 1 year. So as a full-time candidate, so you can still have another one extra year to complete your cases. So mean to say that first year you'll be completing all the 6 modules. So all your teaching and learning will be finished. And for your cases, only for your clinical cases, you can have another 1 year extra to complete your quota. And then once you complete your quota, you submit your logbook, you can sit for your final examination. Okay.
Yep.
There
Yep.
is another option for, those who are very busy practitioners, that I don't have time, but I need a little bit more time. Yes, you're okay. You're welcome. Initially only you will be given 2 years. So mean to say that first year you'll be completing your all teaching and learning in that 6 modules, and you are having initially only, you have told us that you need 2 years to finish your 25 cases. That's perfectly fine with us. And if you need 2 more years to complete your quota, we are giving you 2 more optional years to complete your quota. So total actually, 4 years.
Yeah, 4 years. Total, you have 4 years. So
Yes.
we are very flexible in that sense.
Yes.
Yeah, correct. So ultimately, the learning experience is important.
Yes.
So we need to make sure that you have adequate skills and knowledge
Yes.
to actually get a diploma.
Yes.
So that is our main philosophy in that. The students need to be competent in both knowledge and skills at a diploma level.
Yeah.
Yep.
And you'll be going through a very a correct sequence of how to manage your cases, the correct documentation based on the AE guidelines, based on all the higher bodies in endodontics, how you document your cases, how you present your cases, what is the importance of that particular step, and so you'll be going through, because you need to submit your case report. So which in a one way that once you learn that, I think it will be really helpful for everyone in your future cases to how to document and submit for your case reports or to journals and all that.
Okay, there's one question coming in. How is the diploma program different from the specialist program? So okay. I would imagine this specialist program in Malaysia means a 4-year full-time specialist program where you can be gazetted as a specialist in Malaysia. Yeah.
So as Prof, you have told this, that in Malaysia, we have to follow the guidelines from Ministry of Health, MOE, and NQA. So the specialist, the person is considered as a specialist only if he completes 4 years. That is full-time. So this program is not going to give you that specialist tag. Definitely no, because it's a 1-year diploma program. But definitely it's going to give you an upper hand in dealing with a lot of different kinds of endodontic cases. And those who are interested in endo, those who find a bit difficulty. So I think after this diploma program, you'll be very confident. I feel so. And obviously it's a lifelong learning. You keep on learning new skills and all that, new materials. So I think, but yes, you cannot be considered as a specialist, but you can use this tag PGD Endo in front of your name.
Yes, correct. So definitely the most important thing is you gain knowledge and you gain clinical skills as well. Yes. So like Dr. Shekhar has mentioned, so students will learn a lot on rotary instrumentation and negotiating difficult canals, retreatment, managing complex cases, molar endodontics. So definitely that would give you enhanced skill in managing all these cases, so that you will be more confident in treating this type of cases.
Yes.
So that is the difference between diploma and specialist. So as Dr. Shekhar mentioned, with this program you will not be able to register yourself as a specialist. However, if you decided that, okay, I take 1 year of diploma program, I'm really into endodontics and I really like this field, then if you decided to go further to embark on a specialist journey in endodontics, so when you actually apply for placing in endodontic program, I would imagine that would give you an advantage because you are already at a higher level compared to other candidates. As we all know that, a lot of program only take a few students.
Yeah.
You know, because of the limitation in facilities and all that. So they only take a few students. So a lot of people will be competing for placement in a specialist program. So having this diploma, that would give you an edge in application.
Definitely, definitely.
Yeah.
Yes. If somebody has done diploma, they're going to get a bit upper hand.
Yeah. So, okay, another question coming in. Can anyone who is not in KL or Selangor join this program?
Yeah.
Let's say they are from Kelantan or from Kedah.
Yes, yes, yes. Anybody can join actually. Even those who have fulfilled the eligibility criteria, from any place you can join. You just need to have a eligibility criteria that you have finished your BDS, you have 1 year after your BDS, and 1 year compulsory service you have done, and then after that you can join. And you have to go through that the process in IMU. You'll be, once you registered, you'll be called for a interview, and we'll take your interview. And
Yes.
So everybody has, any student who is joining IMU, they have to go through an interview session where
Okay.
yeah, so once you clear, then I think you can join. Yes.
Yes, correct. You can join. You just need to make sure you will travel to IMU as mentioned for the face-to-face sessions. Then after that, you can go back to your clinic and treat patients. Yeah?
Yeah.
Yeah, correct. So perhaps for logistics arrangement, what our experience with the PGDID, the implant dentistry, what I can share with you, we do have a lot of students from outstation. We have students from Johor, we have students from Kelantan, we have students from Malacca, we have students from Ipoh as well. So sometimes what they do is, after the 1 week face-to-face, they stay on a few more days. So stay on a few more days to treat patients in the clinic in IMU with us. Yeah. So like if you wish to treat the initial few cases in IMU, then after the face-to-face sessions, you can arrange in such that you can stay on a few days to treat patients in IMU. Once you gain the confidence and skills, then you can treat in your own clinic. But of course, we will give you all the support that we have. We have a very robust online support for you. We can use Microsoft Teams to communicate with you in terms of treatment planning in case of any foreseeable difficulty. Yeah, is that right? Yeah,
Yes,
Shekhar?
yes. You can actually maybe take a few pictures, or you have something difficulty, you can share with your supervisor, you can discuss everything. Yes.
Yes. With the current technology, everyone is in the same place.
Yeah.
You know, like now, all of us are in different place, but we can see each other, talk to each other. So
it's the same.
That's not an issue at all. So yes, if you are not based in KL or Selangor, of course you can always join us.
I want to add another thing, Prof. Like,
Yeah, sure.
we are flexible in that. Suppose a student or a candidate who wants to practice more in simulation, suppose, they wants to come maybe few days extra to commit. I think we are flexible with that also. You can come, you can book your place and do more exercises in your simulation. Maybe you're not very comfortable initially with clinics. You want to practice more molar in your simulation. You're most welcome. You can use our simulation lab and do it.
Yes, a very good point, Shekhar. Yeah. Because in the simulation, we are also getting a microscope, right?
Yes.
We are going to have a lab microscope as well. So you can come in initially if you are not familiar with using microscope, which is a very crucial armamentarium in the practice of endodontics. So you can always come in the simulation lab, have your own practice first until you are comfortable, then only you use it in the clinic. So yes, Shekhar, very crucial point.
Yes.
So another question, how many students per intake can you take?
Okay, we follow again the guidelines from the MOE, the approval. We have got 11, we can take 11 students in a batch. We got the approval for 11 students. So maximum in a cohort, in a batch, we can take 11 students.
Okay, so so at the moment, how many have you got?
We have got 5.
Yeah, you got 5. So we have 6 more places, yeah?
Yes.
Okay, that's right. Okay, so another question, only private practice GP is allowed to join the program?
No, anybody can join as long as you fulfill the criteria, means you have done your BDS and you have 1 year of experience. Even you are in ministry, you are in some private practice, you're doing locum, anywhere, you can join.
Yes, that's right. Just to share with you, for our implant program, we actually have a lecturer from USM who is currently our postgraduate implant diploma students. Yeah. So even if you are university, if you are able to take time off from your boss, then yes, you can join. So actually, it's not. Yeah. It's designed for GP for them to be able to keep the clinic running, but it's open to anyone. Yeah.
Yeah, and another thing, Prof, like maybe like, you know, some people think about the money and all that. Example, I'm just giving you a simple example. You have a lot of patients in your clinic, and you are a bit uncomfortable in treating molar. You do start doing your cases in your clinic. You charge, so you can charge in your own practice. IMU has nothing in it. There's no conflict in that. So we are not going to take any. You do your cases in your clinics, charge your patient, make some money. And you know, just follow the guidelines, just follow the protocols.
Yes. Okay. So another question, when will the program start? When is the start date for the program?
Okay, so the start date was actually the planned date was April, but then you know what happened, the COVID happens.
So everyone get locked down.
Everyone got locked down, yeah. So which is very unfortunate. And then we postponed to June. So actually our planned date was June, 18th of June. But again, you know, I think you must have seen some circulars going on from MOE. So we still need to confirm with MOE. We need to just follow the guidelines from MOEs. So there is a possibility that this program will be slightly delayed, but we are not sure right now. So I think we can update you soon once we get a little bit more confirmation about the date.
Yeah, but you can still send in your application with us.
Yes, you can.
So because we are university, so final guidelines still come from the Ministry of Higher Education. So final say lies with MOHE. So we are hoping that we will be able to commence the program soon. Yeah? Subject to approval from MOHE. Okay, from Ben. I assume it's our alumni, I think. Yes, Ben, we are doing well. Hope we are doing well too. Do we need to apply the APC in IMU in order to practice in IMU OHC?
Okay, I think this is again a very, it's a basically a protocol which everybody has to follow, and IMU is going to help you in that. To get your APC done in IMU, IMU will help you.
Yes, yes, correct. So you need to get APC to include into your APC IMU OHC so that you can treat patients in IMU.
And IMU is going to help you, like IMU will help you.
Yeah, sure. Okay, that is not an issue at all. For all our postgraduate diplomas, implant dentistry students, all of them are able to treat patients in OHC. Okay, yeah, that's good. So keep the questions coming in. Once again, it's really great to see so many people are showing interest in field of endodontics and would like to have a bit more information on this program. So can we talk a little bit on like in a way when patients have complications and you need some help from the supervisor, what are the support that we can provide to the students?
Okay, yeah, it's a very good question. Okay, I'll give you a few examples. There might be an option. Suppose there might be a possibility that you're treating your case in your own practice, and you are stuck with something, you know, which you want to discuss with your supervisor. So the first thing what you can do is you can talk to your supervisor through any means, like, you know, maybe in any online mode. You can talk if you can understand what your supervisor is saying and you can do yourself. I think yes, this is one possibility. There might be another possibility that you have done a major error, and now you have now lack of confidence, and you want to, you know, you want some help from a supervisor. And so there are two possibilities. You can temporize it, and you can refer that to IMU, to your supervisor. That can be managed in IMU. This is one possibility. Suppose you don't have a microscope and that case required microscope, so you can refer that back to IMU, and you can come along with that and understand. Or there's another option. Suppose you want some help from a supervisor, so we can help you to provide a supervisor in your own practice. You know, we can help you in that also. There's some we need to talk to the supervisor. We need to just fix one date, and there might be some some honorarium charges which you need to provide to that supervisor based on the hours he spent with you in your clinic. So it's quite flexible in the sense, if the problem can be solved by just talking to a supervisor, maybe it's a very small problem and it can be solved by just communicating with your supervisor online. You can try that way. That's one option. Second is, you don't have any instrument, you are lacking with some confidence, it's some major error has happened, you want to refer back to IMU. You can temporize it and you can refer back to IMU. That's another option. Third option is, yes, you want a supervisor to be provided in the clinic. That also can be provided.
Okay, that's great. Okay, another question, Dr. Shekhar, can you elaborate a little bit more on the final exam structure, like how the exam will be conducted?
Okay, fine. So basically, the whole assessment part will go throughout the year, throughout the 6 modules, correct? So there will be a lot of formative assessments. There will be a summative assessment. I think you're familiar, everyone is familiar with those terms. Huh? Formative basically will improve you over a period of time. Summative, which carries some marks. Okay. So out of 100%, we have divided into few sections, you know, like you submit your case report. Like suppose example, you have to submit 3 case reports. You have done your case. You have to submit your case report based on the guidelines, which we will provide you. So every case report carries 10%. So if you're submitting 3 reports, the first report has to come after 3rd module. Then your second case report will come after 4th module. And then 3rd case report will come after 5th module. So 10%, 10%, 10%, which carries total 30%. So submission of your case report carries 30%. Correct? Now you have after you have done your module 3, you'll be having something like an ICA, like a in-course assessment, where you have to sit for OBAs. You have to go through OBAs and SAQ, and again which carries few percentage, like 20%, suppose. So you have done that. Then you have a final examination which has again OBA, SAQ, and you have OSCE. So total together will be 100%. So based on that total, throughout that assessment, you will be declared pass or fail in once you gone through the whole assessment throughout the year.
Okay, basically, so the principle is that such that because this is a very clinically based course, so 40% is based on theory and 60% is based on clinical experience.
Yes.
Like Dr. Shekhar said, you submit your case reports, then each case report is 10%, and the final exam has OSCE. For those of you, the younger generation would have gone through OSCE. So for those that have not gone through OSCE basically is a short clinical exam where you go through different stations, and these stations can be a little bit of skills testing, a little bit of patient communication, discussion of treatment planning, and discussion of management of a case. Yeah, so this is OSCE. And OBA in short form is actually a one best answer type, something like your MCQ. It's the objective questions, yeah. And then SAQ is a short answer questions. Instead of writing long essays, so we are asking more specific short answer questions. So it's not a difficult exam. So if you have done your work throughout the course, you should be able to get through the exam. Yeah. Yeah, correct. Because 30% come from case report, which is the case that you have treated. Correct. Yeah. So does this say you mentioned that you have 25 cases in order to sit for final exam, right? So these 3 cases is inclusive inside the 25 cases?
It is included in that.
Okay, all right.
So the total 25 cases, this 3 separate case report will be included in that. And this 25 cases is not only molar, it is a combination of your anteriors, your premolars, your molars. If you get endoperio sort of thing, or a, something like a multidisciplinary where you've done some perio treatment along with endo. So it's like combination of everything.
Okay, so it can be of any nature, yeah?
Can be of any nature.
Okay. Does it have to be completed until crown restoration?
We have given you only, you don't need to complete all 25, obviously, but at least that 5 cases has to be completed with total proper post-endo.
Okay, what about the case report? Does it need to have a crown restoration?
We expect that, obviously, because it's not like, just incomplete. We are not teaching you only just doing endo. We are basically teaching you how to, deal with your case. So comprehensive properly, how you tackle your case. Just not only focus only on endo, just do that. No, we expect that you don't only focus on that part. We should focus on other things also. So
because coronal leakage also is important, right? Because coronal leakage has been known to cause failure of endo as well. So obviously, to complete the root canal treatment, you need to have a proper coronal restorations.
So it should
to avoid coronal leakage. Yeah, that's good. Yeah. Okay. Any more questions? Please feel free to post up here. We are most happy to answer. Okay. Now maybe we can talk about a little bit on industry partnership. Can we talk a little bit on industry partnership then?
Okay, I think IMU is a very, in that we have a very good partnership with a lot of our, companies and all that. And so we'll be providing you a lot of opportunities in the sense where we can get some, we can arrange some CPD courses, or small CPD courses where you can join, all candidates can join, like a small 1-day course or 2-day course where the company people can come and they can talk about their product, or they can talk about, something which is very relevant topic in endodontics. So you'll be going through that also. And we have a good partnership with actually the major companies like, in Microscope, Carl Zeiss, or, in rotary instruments with VDW, with Dentsply. So we have a very good partnership with them.
Okay, that's good. That's good. So you get to try various companies' instrumentation.
Because as a student, we are not biased with any instrument, and I always tell to all my students also, we should not be like, we should understand the whole concept rather than, so you'll be getting an opportunity, not only focus on one particular system, you'll be getting an opportunity to actually learn different systems.
Yeah, that's good. Yeah, that's good. So you decide. You get to try all sorts. This is a good opportunity. You get to try all sorts and then decide for yourself what is best,
What is the best for
or
you?
what works in your hand.
What works in your hand?
You know,
Yes.
everyone has their own personal preference, right?
Yes. Yes.
Yeah. So this is a good opportunity to try out different instruments.
Different instruments, different machines. Yes.
Yeah. So, Shekhar, let's say the students want to bring their own patients to OHC, right?
Yeah.
How much does the patient need to pay for the root canal treatment?
Okay. So, so when you get your patient, it's patient will be charged. Patient has to pay. Obviously, it's to Oral Health Center, but you'll be getting some discounted price. We have not finalized the exact price. It will be roughly around 20% discount, but it has to be finalized. So the patient has to still pay the root canal charges, but it will be a bit discounted price.
Yeah, discounted from the actual OHC standard fee.
Because you have to consider you all are doctors actually. You know, you're doing a postgraduate. You're not like students, third year, fourth year, fifth year student. You are all graduates. Some of you are very experienced people. So I think you have all the right to charge.
Yes, correct. Very true. Because sometimes also patient may think that, oh, these are still students, but they are actually working dentists already.
Yes.
That's good.
Yes.
So, Shekhar, so let's say the students would like to do more than 25 cases as extra practice before taking the exam. Is that okay? Before completing the...
We are okay. We'll be very happy if you can do that.
Yeah, we have a very good students here want to do more. Yeah.
Go ahead. We'll help you.
Yes, most definitely. We will be most happy if you can do more, because then in that way also you will gain confidence and the skills as well. Okay.
I have done thousands of root canal. I'm still learning. Everybody's learning. Every day is a new challenge. Every day is a new thing.
Yeah. Every root canal is different.
Yes, everything is different.
Correct. Every root canal, it's a new thing.
It's a new thing. Yeah. So that's how we learn.
Yeah. So it will be more interesting to see new things every day.
Yeah.
Yeah, that's good. So let's say you have used microscope, right? Yeah. So can you give any advice to people on using microscope?
Okay. Okay. So in microscope, actually, it's a totally different world. Actually, you know, I can just assure you, you know, in one way, if you start using microscopes, you will not go back. You know, once you are trained in microscope and you start treating patients, and it's a learning curve. You can't expect that this day one you will be perfect. No, it's a learning curve, but it's a learning curve where you can learn day by day and you can improve your work. And trust me that when you start working with microscope, when you start working with magnification, maybe if you have not worked with the simple loops, I will advise you, maybe you can start immediately with loops. It's a totally different story. You start seeing better. When you start seeing better, your quality of work improves. You know, you start seeing your cases in a different aspect. Your whole idea changes, and it's just you know, a learning curve. The more that you do, the more you learn. You can document your cases. You can take nice pictures. You can show your cases in different platforms, in conferences, in posters. You can submit your case reports. You can actually show your patients. So when you show under the microscope, when you show all the pictures, patients appreciate. They appreciate that what doctor is doing actually, you know. So it's a wonderful tool. It's a wonderful tool. So if you're getting
patient-doctor communication as well.
Yes.
I totally agree with you. You know, I have been using loop. I don't use microscope. I have been using loop for the past 3 years or so. Initially, I get this idea, oh, only when you are old, you cannot see properly, then you have to use loop. No. You know, so then after that, one of my friends introduced loop to me. So since then, I'm seeing a new world, like you see. Yeah, so now I feel that so inadequate if I don't use my loop, because I don't see the details.
Yes.
I want to see the details.
I bought my first loop on my first day of my post-graduation. First day when I joined my postgrad, that day I went. So 13 years back, actually, I got my loop. So,
yeah.
and it's a totally different, you cannot work without that now.
Correct. Yeah. You see, you see so much detail that you are beginning to wonder, why didn't you use it earlier on?
Yes. So it's a gradual learning curve. Maybe you will find a bit difficulty. You will feel that, that it's not for me, but obviously everybody goes through that same stage. The more you use, the more you understand, it's not difficult. Trust me, it is not difficult.
Correct.
Yeah.
Okay. And anything else that you think will be of interest to the students that you would like to share?
I think another thing what I want to tell everyone is, because we're not just targeting a simple, just to learn some skills and send you. No, you'll be very connected to us, like as an IMU alumni. I think IMU alumni is very strong, and we have a very good connection with our all staff members in one way. And another thing what I want to say is, like, we basically, when you're going through this whole process of learning, you'll be very confident, because you need to present, your cases, you have to present your seminars, you'll be having a very detailed discussion with your supervisor. So in one way, you'll be more confident in, presenting. That is another very, very important thing, which I feel, there might be many people who are very good clinicians, but that confidence is not there. So you will be going through the whole process. So I think in one way, in 1 year, if you can learn all these things, I think it will be great.
Yes. And on and off, we have external speakers who come by as well.
Yes.
So students and alumni are all invited back for the talks and things
and all that. Yes.
Yeah, correct.
You'll connect with us all the time.
Like you mentioned, we have good partnership with industry.
Yes.
So all these industries bring in good quality speakers. On and off, so they work very closely with us to conduct CPD programs or evening lectures or seminar. So all the students or the alumni will have the opportunity to listen to them. Yeah.
Yes.
Yeah. Okay. Any more questions from all of you?
You're free to ask anything, whatever you have in your mind, please ask us.
Yeah, so we will be most happy to answer whatever questions.
Even if you feel that question doesn't make sense, we are okay with that.
Okay, I think it's almost 6:30 now. Once again, I would like to thank everyone for taking time out to listen to us, and feel free, even if after this some questions pop up in your mind, feel free to contact us for further questions.
Yes.
Yeah.
Yes.
Okay. So once again, thank you very much to Dr. Shekhar for sharing this program with us.
No, thank you so much. Thank you everyone for spending time with us. Okay. And hopefully, yes.
Okay, thank you everyone. Stay safe.
Stay
safe. Yeah, and keep well.
Yeah, hope we can
hope to see all of you in real situation somewhere, sometime.
Yeah. Thank you so much. Thank you everyone.
Okay, bye.